Hi, good afternoon. It's 2:30 now, and now I think we shall start. And thank you coming on board for the session on third session on how I do it session. It looks like this is a niche club in some way. We got to promote more. So, but it has been about 15, 12 participation. We hope as we go on, the culture will spread and more will come on board. I can see, Prof. Dr. Chin Kok Yung and Dr. Zalina and Prof. Zaliha, yeah, quite a few people we know. Thank you for coming on board. And Hannah from MSK, yes, thank you. So we do spread the news across the university, and hopefully they will join. This is a lot more, sometimes touching on clinical topics. Yeah. So we have today the first session with Prof. Dr. Akmal. Shareela going to share with us TBL online. How do we conduct that? And then we have a flipped classroom style by Prof. Ismail Saiboon later at 3 o'clock. So we have about 2:30 to 3:30 slot. I think be a plus minus, and we encourage some question and answer at the end. So for those who are here, we might want to wait until the end. We have a QR code for you to log in. And yes, so we'll keep things sweet and simple. Yes. Prof. Akmal, stage is yours. We hope to hear from experience and how we can share. Thank you very much.
All right, thank you very much, Prof. Tong. Assalamualaikum warahmatullahi wabarakatuh. Good afternoon to my fellow friends. I saw that one of my classmates from the medical education. Welcome to the sharing session. Today, I'm going to share with you my experience to conduct a virtual or online team-based learning. So for introduction, my name is Noor Shareela Ismail. I'm from Biochemistry Department. I'm the head of the module Human Genetics that I teach year 1 and year 2. So in this sharing session, I will focus on how I conducted virtual team-based learning in a Human Genetics module. So this presentation or this sharing session will be divided into 3. So first, I would like to introduce to you the principle of TBL and to share with you the practice of TBL and how to convert conventional TBL to virtual TBL. So TBL means team-based learning. So this is my first paper in MJMS, Malaysian Journal of Medical Sciences from USM. So this paper I reported on the effectiveness of team-based learning in teaching medical genetics to medical undergraduates. And from this paper, actually, I got a lot of queries from many lecturers from different universities on how to conduct team-based learning. So this is a little bit of my story before we go into the team-based learning. Back in 2012, when I went back from PhD, I joined as many as lectures from junior lecturers, from senior lecturers, from the professor, to learn on how to be a good lecturer, on how to make students focus in their lecture. But when I sat at the back of the lecture hall, I found that most of students actually their attention span is about 10 minutes. After that, they lost focus. They play with the handphone. They talk to other friends, and I found that this is very it's such a loss for both students and teachers, because we have dedicated 1 hour lecture for that specific topic. So I think that the didactic learning or the lecture, one-way lecture, is not suitable to the millennial generation. So I would like to share with you one quote that I snapped in the Faculty of Education while I'm doing medical education, master in medical education. So if we teach today's students as we taught yesterday's, we rob them of tomorrow. So we want to be relevant in the current generation. We want to teach them how they need to be taught. So let's say if you see this biochemistry or the metabolism pathway, you feel like, oh, biochemistry is so hard. Do I need to memorize all of this? If you ask me, I also need struggle, and I need to have like first or second revision before I can teach my students. So almost all students say that biochemistry is difficult. They think that they won't remember it during the clinical years. So how about this? So this is the DNA sequence. So how students can appreciate the DNA sequence, on how to even to sequence them, and on how this DNA sequence actually can benefit us, whether it's a healthy person or with someone with a disease. So identify the problem first. So in my module, human genetic module, is quite tough actually, because it has a high, it's much related to the high technology application. So I choose two topics in the module that really dry, very that students need to memorize and very repetitive, because they have been through or they have learned this topic. For instance, cell cycle and mutation and mutational analysis. So they have learned it in SPM, they have learned it in STPM, A level, and then they will say that cell cycle again. So I want to reiterate, I want to reinforce this knowledge to the higher level. So that's why I need to integrate to the high technology application, which much needed among the medical graduate, where they have to know what is precision medicine, what is personalized treatment, what is integrative omics. So so this is the one step further. Okay, so students do not fancy biochemistry, because I think biochemistry is something that molecular, student cannot see with your naked eye, so they cannot appreciate biochemistry. And in our department, we have a lack of lecturers who are well versed in genetic topics. Yes, we are all biochemists and we are all have our own niche, but very less lecturers who are really dive into the genetics topics. So I said, all right, let's do team-based learning. So I like to do something different. So I learned one-to-one with Professor Dr. Halina Hadi Chiras, which is our pengarah citra. So I started to experiment this method to the first batch in 2015. If you look at this picture, this is the first, this batch actually has graduated. So they have done their pro exam in last December. So we did the first TBL in day 1 kuliah 1. And during this time, students can utilize any space in the DK, even outside of the DK, as long as they can discuss. So that is why the team-based learning occurs. So it much related to the active learning. So the normal student that will be sleeping, normal student that will play with the handphone. Usually, if they play with the handphone because they want to look for the further information. So later on, we upgrade to day 1 peperiksaan. So they have like certain discussion to complete the assignment. So for this session, I have helped Garina to conduct her team-based learning on her topics. You can see everyone is mingled around. Everyone is trying to discuss, to check for the information by their notes, through their textbook, through their phones. So that's one of the essence of the team-based learning. Okay. All right, so let's go to the principle of team-based learning. What is actually team-based learning? Team-based learning is actually divided into 3 different phases, which is 1, preparation phase, where the lecturers will give all the learning material, whether it's online, whether it's textbooks, whether it's lecture notes, and student needs to read all the learning material before coming to the team-based learning session. So during the team-based learning session, they will be tested through two different tests, which is IRAD, which is Individual Readiness Assurance Test, and TRAD, Team Readiness Assurance Test. So through this test, we tested them on their comprehension towards the learning material that we gave to them. So this is the closed book session. So they will, usually the question that we give to them are MCQ question. So and during the team-based, during the TRAD session, if they have any question, any burning question, they will raise their hand, and the lecturers will go around the DK1 to find, to try to explain to them, and then try to reinforce the knowledge that they have learned. And another phase is the application phase, where the lecturers will give a case-based learning question, a scenario-based learning question for the team to discuss and share their answer with their peers. However, I did some modification on my TBL back in 2015 and 2016. Instead of ask them to read all the suggested link that I have given to them to the learning material, they have to submit an individual mind map, because I would like to ensure the student to read all the material. So they are compulsory to upload the mind map through the email. And then during the TBL session, I spent about 15 minutes for IRED and 40 minutes to GRED. So I printed the quiz on the A4 paper. So can you imagine if we have 200 students and then we have 2 pages of MCQ question? So I wasted about 400 papers there. So I'll try to think, how to do it virtually, how to, moving forward to do online. So, so this is my first attempt in the TBL. So the second attempt, instead of sending the individual mind map to my email, okay, I found out a Padlet, a platform where they can share actually their mind maps and see how other friends doing on their concept map and on their mind map. And instead of print the papers, I shifted to Kahoot, where they can play through individual and team. Through team. So after that, I will give the application question and they will discuss about 40 minutes and they will upload their question, their answers through Padlet. Okay, so the benefit of Padlet is each one of them can use this platform to revise, to compare the answers from one group to another. Okay, so let's go to the virtual TBL. So I have done virtual TBL last week, actually, because of our student is actually in campus. However, they need to be quarantined for 10 days. So I have to opt for virtual TBL. So I try to crack my head, how to go around about it. So I have found a paper here, which is entitled "Study of a COVID-Induced Transition from Face-to-Face to Online Team-Based Learning in Undergraduate Family Medicine." Family medicine is one of posting or department who actually has a very strong practice in the TBL. So by using a little bit information from this paper, so these are my innovation on my e-learning. So first things first, I need to ensure that each PBL group have a breakout room in the MS team. So I think there is no problem, because each PBL group has their own channel, so where they can discuss to complete on the assignment. So, and all material will be uploaded on the UKM folio. And then the student must scrutinize all reading material before coming to the TBL session. And they must upload the mind map on the Padlet. Okay, so during the virtual TBL, I extended a bit. Instead of having 2 hours with them, I extended 1 hour session exactly before the team-based learning session, for them to discuss on the application question. This is to replace the TRED. Because in the principle of TBL, we need to have IRED, TRED, and application question. So the application question, I give to them 1 week earlier, and then they have to discuss, and then they have to prepare 1 slide, a 5-minute pitching, and it must be recorded. So during the 2 hours of TBL session, I will play the game with them through IRED. And then we'll watch the videos for 16 groups for 5 minutes. And then after that, I will give them the application question. So these are my plans. So these are the timetable. So we have another 1 hour for preparation for online TBL, and another 2 hours to do IRED, to watch videos and answer sample questions. Okay, so these are the breakout rooms in the MS team. So each PBL group has their own channel or breakout rooms. Okay, these are the instructions to students. So I have uploaded it onto UKM folio. I already shared it with through up. So they have to watch, in this instruction, they have to watch 9 mini video, which is about 3 to 5 minutes max, to explain about each of the subtopic here. Okay, and then they have to come up with their mind map. So they have to submit their mind map onto the UKM folio. So how would you do that? So you add the activity here, and then you click assignment. Then you put in the assignment name, the description, and then you put the deadline. And then they can submit the mind maps onto UKM folio. Or other things, they can always upload the mind map through Padlet. Okay. All right. So during the TVL session, so we are playing a quiz. We shifted from Kahoot to Quizzes because I felt that Quizzes is more user friendly and it's free. You do not need to upgrade. So the Quizzes actually have a feature where students will play at their own pace while you watching the leaderboard. So here the leaderboard. So if we have like 154 players here, as they go along with the quiz, let's say if I have 20 questions, per question about 10 to 20 seconds. So you ask them to play at their own pace. And then at the end of the quiz, you can track their performance by the gauge meter here. So you know that if the green one is most correct one and the red one is the incorrect one. So by clicking on the question, you can dissect the question, which question have all wrongs or which question have all correct. And from that question, you can give feedback to them directly. So that's for the IRAD. And then for the TRAD, so I gave them 2 landmark papers. So what are the landmark papers? Landmark papers are highly influential papers that have substantially changed the practice of medicine or provide the missing evidence to support current practices. So usually they will come from a review paper. So I give to them 2 landmark papers, one on the cell cycle and another one for whole genome sequencing. So I divided them into 16 groups. So for group 1 and group 8, they have to read landmark paper number 1, and group 9 to group 16, they have to read for landmark paper number 2. So each landmark has their own task. So the first task for group 1 to group 8, they have to formulate an experiment on how to develop an anti-cancer drug by reading on this paper. And the group 9 to group 16, they have to choose a disease and a mutation involved and how whole genome sequencing can help in the formulation of precision medicine. So so they will prepare on the 1 hour preparation before the team-based learning, and they have to make a presentation on 1 slide for 5 minutes pitching. So during the brainstorming station, so I will meet with them to brainstorm with them and ask them where they got the paper, the journal, and why are you interested in that particular gene or particular disease. So I will spend about 5 minutes for each team. So I will utilize a 1 hour session with them. So we call it this team readiness assurance test. So these are the example of their presentation. So we have like glioblastoma here, and then we have oral squamous cell carcinoma, and then we have pancreatic cancer, and then we have malignant melanoma, we have PCOS, all of them are lung cancer and multiple sclerosis. So after the IRAD, we will be watching the 16 group together, and then it's equivalent to 1.5 hours. And after that, I will give them 2 sample questions for them to attempt. So these are the sample questions. For example, you as a medical scientist would like to develop a novel drug for cancer X. Based on your knowledge of the cell cycle, briefly outline your experiment and justify your answers. And another question, Whole genome sequencing is a powerful tool to address mutation in both intron and exon region. So this serves an information in curating a personalized treatment. So by using the above concept, advise Mr. X, who is concerned of his chances to get colon cancer. So he has a strong family history of the disease. So basically, they don't need to memorize what are the genes involved. They need to know the concept first before they can apply it into this question. So after that, of course, we need some feedback and reflection. So I told students that be like makcik bawang, but be an educated makcik bawang, meaning that you tell other people something with supported by facts, by finding in the reputable journal. So there are 3 new things. So I asked them to write feedback and reflection. What are 3 new things they have learned in the TBL session? What are 2 things that they want to research more and share with your family and friends? And 1 thing that I want to change by learning something new in this TBL session. So by doing that, I created a feedback section in the UKM folio. So you can click activity and add feedback. So these are the questions, 1, 3, 2, 1. So these are the summary of their reflection. So 3 new things I have learned. So they have learned new genetic diseases and genes involved. Teamwork is important. New way of learning of a topic. So they have to learn about how to make a compact note is a 1 A4 paper. How to run experiment to treat cancer. What is the importance of whole genome sequencing, and how to apply the knowledge of the mutation. 2 things that I want to research more is genome sequencing, early screening, gene therapy, the disorder of expression of the gene, the past website paper, genetic counseling is needed, and how mutation in DNA leads to cancer and any diseases, and how much our lifestyle is actually affect us. Okay, so 1 thing that I want to change. The student said that I want to change how I did my map, because they this student actually looked at others my map at the Padlet, and they said that, oh, my map is incomplete, so I need to complete my map. So the method of study is based on the team-based learning, and then appreciate every single in my DNA, my body. So every single reflection actually can help the student to be better. Okay, so this is the feedback, further feedback for the conduct of the team-based learning. Okay, so of course there are a few challenges to do virtual TBL. So first thing first, I recognize the internet stability, because I instructed them to do the team-based learning by switch on the camera, but due to the Wi-Fi is not stable, so most of them cannot do that. So so internet stability does actually impact on the social presence. And the breakout rooms for discussions, you must have a breakout room in the channel, and then you must use the UKM folio for both asynchronous and synchronous. And for the application question, you can use scenario-based, problem-based, case-based learning, and then always tailor your teaching or your activities to the time dedicated to you, and have the coordination process that abide the principle of TBL. So take home messages, please choose wisely. By now, I think you already know what are your problem statements, but not all topics can be converted to TBL. Usually we converted something like very, very hard or need extra attention by the content expert. Okay, so always link your activities to UKM folio to make your module blended. So the beauty of the medical education, you as a lecturer or the teaching or learning package designer, you can use all of free platform available online. It doesn't matter of you Googling it, or you ask certain tips from the Duta, or from anyone who has conducted e-learning. So active learning also can happen virtually, but must have social presence. Okay, So if you do some innovation in your teaching and learning, present your work at K-Novasi. So in this year, will be held online in August. So publish your findings, publish your innovation, utilize your scholarship of teaching learning. So, but it is indeed a hard work, but it will be paid off eventually. Because I still remember my mentee when he was in the 4th year in the pediatric posting. He came to me and he said that doctor, I saw like a very like rare case that is like involve genetics, and then I found like, you know, I read some journals and I found that there are certain gold standard to diagnose this patient based on the genetic sequence, DNA sequence. So I think the application part is important, you know, by using the knowledge that they have learned in the preclinical and how they apply it during the clinical years. So don't hesitate to email me at nasismail@ukm.edu.my for any instructional design consultation or any of your teaching plan. So whether you want to use certain activities, whether it's visible or not, whether you can utilize UKM Folio or MS Teams or any online platform. Okay, with that, thank you very much. So I welcome any question from the audience.
Yeah, thank you, Akmal. That's very exciting. How many of you want to be in Akmal's class? I want to volunteer myself. It is indeed very exciting, full of activities. I think our students have a lot of fun, I can see. Yep. So I'll give more time for question, and then please ask Akmal anything that you want to find out more about this TBL, exciting TBL. Not this TBL, online TBL. Okay, go ahead, please.
Online. I don't know. I think sometimes people that don't want to go for the team-based learning because the work that lecturers need to do before the team-based learning and during the team-based learning. So I think if you have, because my main aim is to develop critical thinking of the student, and this must start from since year 1. We cannot start from, you know, year 3 and then after that, I mean, to me it's too late. So that is why I would like to, you know, advocate team-based learning to all the lecturers, my fellow lecturers, to use at least one TBL for each module. So that is my aim and my vision. In every module we can have like 1 or 2 topics that can be converted into TBL.
Yep, I fully agree. You know, it's not just about getting knowledge across. I see your student writing back, you know, they learn the methods, how to learn as well.
Yeah,
you know, team-based, team learning, designing better mind map, methods of searching. All these are tools, and we say that we always want to teach people how to fish. This is exactly how to fish, in not just giving them the fish, you know, the kind. So we are not offering information, but also a lot of teaching, learning method they learn along the way. That's fantastic. Congratulations, I think that's fantastic.
Thank you very much, Prof.
Yeah, indeed a lot of effort, but I think the rewards is definite, because at the end of the day, student wants to learn, and that's what they take back, right?
Yes.
Yeah. So a lot of principle of adult learnings are there, like, you know, active learning, designing, and how to capture attention, and yeah. So those are real great stuff we can bring home. I want to know how much time you spend to prepare or this is always an issue, how much time you spend prepare the whole, the design, you know, sit down and think about how to do it.
For the virtual TBL, I took only 2 weeks.
Okay.
Because we are the content expert, we know we know the learning materials that we need students to read or to watch, and then the quizzes actually it's a simple MCQ question. It's like one correct answer question. So you can, if you stumble upon that, maybe you can like try to Google any online quizzes on internet, and then you try to adapt to your learning objective. And then part of that during the TBL, I think I spent a lot with them during the preparation of the TBL. So I spend about 1.5 hours. That is synchronously. So asynchronously, they will revalidate their slide, their topics through WhatsApp. So they always WhatsApp me, and then yeah. So that the 2 hours session of TBL, and then that's about it.
Yep. But this is your first time using TBL for this topic? I'm using your TBL for this topic, yeah.
For this topic, I have like I have taught this for this topic for 5 to 6 years.
Oh, okay. But adopting TBL is also 5 to 6 times. Is it 5 to 6 times?
Yeah.
Yeah. I just want to know, I'll be assured, that's thing pretty getting easier and easier for the following years, isn't it? Because how to teach them is already quite laid out, isn't it? The initial thought is difficult, right? Yeah, okay.
Yeah.
That's great to hear. Yeah, there's a question coming in. Allocating 5 minutes for feedback during the TREC is quite short. What's the tips on what to look for in assessing them in this short period of time? Yeah.
Okay. Before, during the preparation of TREC, I always tell them what is to be expected from them. That is why the assessment getting easier, because I told them, okay, you need to choose one disease and choose this specific gene, and they validate the gene and the papers or the journal during the preparation time. That is why the assessment during 5 minutes time, I think is sufficient at their level, at the first year level, because I don't want them to go too deep. Because I just want to do the principle of the sequencing, how they can detect mutation, as we can like set the benchmark to them, and then tell them what we are expecting them to present. So if you can do that before the team-based learning session, I think you can 5 minutes is okay, I think.
So they actually write in their feedback to you?
Yes, yeah.
Yep. So that takes up save quite a lot of time, because they will write in and we read. That's quite quick. Yeah. Do they share their feedback together in your Padlet as well? Is that the platform, or
No. I just asked them to upload their feedback through UKM Polio. So I plan to do that. I plan to do share the feedback. Maybe in one or two slide during maybe after the end of module exam.
Yeah. What I found Padlet very nice is because you can share many things together with peers. Everybody can see everybody's work. That's fantastic. Yeah. Any more questions? I think this is a last traits of TBL session, and so going online with TBL is not difficult, I guess, but a little technology usage. Yeah, technology usage.
True.
Right. You can type in the question in the chat as you go along, and yeah. Okay, that's great. Okay, that's great. So now it's 3 o'clock. This session will be available on our active learning Microsoft team. You join, be a member, you will be able to access it later and still revise how things can be done online. Right, I think we'll thank you, Dr. Akmal. I think we'll give a session to Prof. Ismail. And Prof. Ismail, you are here. Thank you very much for joining us. And we have a very good response today. Actually, we have 29 people, and there are still Facebook people on the Facebook site as well watching. So thank you. And Prof. Ismail, yeah, platform is yours. I think Prof. Ismail don't need much introduction. Okay.
Okay, all right. Don't have to introduce. Okay.
Okay, just one word, simulationist. I'll get it right.
Okay, but I think I would like to congratulate Dr. Akmal. I think that was a very wonderful presentation and very nice way of doing TBL. I think that's really good. Okay, so coming to mine. Okay, my one is not that hi-fi as Dr. Akmal punya. Okay, my one is very basic, back to the basic lah. Okay, now what I'm going to share with you all is regarding this. If Dr. Akmal teaching more of a cognitive, I'm teaching more of the skills. Okay, the psychomotor skills. Okay, slightly different about this thing. So if I can share my slide, share with the sound. Okay, all right. Okay. All right. Can you see this?
Yes.
Okay. All right. Okay. First of all, thank you very much to Prof Tong and the organizing committee for inviting me to share my how I do things. This is on the flip skill enhancing video. I don't know is that a correct term? I'm sure you cannot find it because this term I just coined it. All right. That's what I like to do, just coin up things. Okay. Hopefully it will stay. Okay. Now, actually, I prepared this talk for the 10 minutes. It was my fault. I thought it was on a 10-minute session, but actually it's a 30-minute session. So we will have a lot of time for Q&A. All right. So, okay. Now, this is my content. Simple, 3 things. And okay. Now, medicine is, as you all know, is a mix between science and art. And apart from cognitive component, it have a very fair share of its psychomotor skills. So this is what I'm going to share with you regarding how do we teach psychomotor skills for students to perform their clinical examination of procedural skills during this period of COVID pandemic, or even maybe after this. So those of you are very busy, because this technique, what I'm going to show you, is going to save a lot of your time. Okay. And psychomotor skill is also important, and it's actually crucial to good patient care. And psychomotor skills basically are used to ensure the safety of patient and team members. Now, there are many ways to perform these skills, but usually psychomotor, well, people can say, oh, cognitive you can teach online, but psychomotor skills rarely you can teach online. I agree with that. Most of the time we teach face to face in a classroom. And the important thing is that we need to know the steps of the skills that we want to perform in order to apply effectively our critical thinking skills in situation where they face in the clinical setting. So they need to know the step and how they're going to apply this step in a clinical setting. If they need to vary it, you have to vary it, but they should not basically miss the important things. And therefore, I think teachers or instructors need to plan their approach in teaching these things so that the student will get the main gist of their clinical examinations, whether it be a examination technique or basically performing certain procedures. Now, before this, I think I'm sure you have heard this old Confucius saying, see one, do one, teach one, right? And there are also previous technique that I've learned previously on doing how to teach psychomotor. You say about this thing, you rattle down what you want to do, and after that you show what you want to do, and then after that you say and show what you want to do, and basically you get other people to do it and you comment. So that's one technique, but that's usually done in the face-to-face classroom. Now, just a quick recap. Bloom's produced this. I'm sure a lot of people know about this Bloom taxonomy in terms of the cognitive, but these are basically Bloom's taxonomy in terms of the skills. So the lowest level is imitation, and followed by manipulation, and then after that you go to precision, articulation, and naturalization. So finally, we want them to be this is like a natural thing that they can perform with their eyes closed. But before they can go to that level of naturalization, well, they started off with a simple trying to imitate what people do. Okay, that's where simulations come in. We like to imitate, and then after that, they will go into manipulation, meaning that they're able to perform the skill by following some instructions. So you tell them what to do, they do it, and then after that, they go to at least a level of precision where they're able to perform skill with minimal errors and with more precise, which is usually smooth and accurate, without having to read certain things or read the step by step of how to do it. All right. Hopefully, they're able to improve themselves to able to solve and modify the skills if they feel it cannot be done through the normal way. Okay, and finally, they're able to go to the naturalization stage. Okay, this is actually another way how you look at it, the Simpson level of psychomotor skill, which is roughly about it tells you about the same thing. Now, to me, how I see clinical teaching, this is actually how I see. Maybe different people have different way of seeing things, but this is how I see it, especially in terms of teaching of psychomotor training. I will not touch anything about cognitive or affective training. Okay. Now, this psychomotor training, generally when we say about psychomotor training for undergraduate students, especially, we are basically talking about examination skills or skills to do procedures. It's either or that. And in terms of examination skills, what we want to teach is actually at least they know what are the steps of how to perform a certain skills. And basically, they have to able from by performing that steps, they're able to elicit. Example, they have to elicit that the lungs there is some crepitation, there is some murmur in the heart, or there is some abdomen which is there's some tenderness, or there is some mass in the abdomen. So this is a lot of they need to elicit. So they need to perform the steps, and by performing the steps, they're able to elicit. Now we have to see it all, because basically I divide it into two things, because when you do an online teaching, sometimes you cannot just go together hand in hand. Sometimes you can, sometimes you can't. Same goes with procedural training. If you are teaching procedure, again, one is actually the student must master the steps of how to do that certain procedures, and then after that, if they need to elicit certain things from that procedures, the easiest examples actually I can give you is like doing CPR, performing the step of doing the CPR, putting the hand on the chest, getting the hand together, and basically straighten the elbows, bring up the shoulders. They're all steps, but the elicit actually can they give that 2 inch or 5 cm compressions and so on. So these are the elicitation thing. So I can tell you that performing steps is not difficult. But in terms of eliciting, after performing the step, can they elicit the thing that they're supposed to elicit? Well, that's the challenge. All right. Online teaching steps, you can either use a video base, or with some feedback. Either you can use as a role play, or you can use SPs. You can do that. But in performing step, example, you want to examine the chest or the lung or the cardiovascular system, you can basically show the step of how to do. In terms of eliciting whether what they are hearing the correct thing, then this is actually they have to split it up, meaning that you have to take other inputs. So basically in teaching skills, maybe, well, if they put their stethoscope on the wall, definitely they will not hear anything. But if they put the stethoscope on the wall and they put their headphone up, then you can play the sounds of crepitations. Then they say, aha, so this is how the signs of crepitation is. Oh, this is a sign of splitting heart sound. So these are the things that they need to elicit. So they need to go through the flow of this performing those steps and basically what they are supposed to elicit. Looks actually well, say, oh, so complicated, but it's not that complicated. If you can do it in a simple program, it's actually it works. You can put your stethoscope, or they can put the stethoscope on the child's, or on the toy, and they say, there is the sounds of murmur or something like that. Okay, now, but in terms of percussion, in terms of palpation, that is a little bit challenging in terms of this thing. But luckily, in examination of the chest or examination of the heart, yes, there's bit some palpation that you have to, in terms of the vocal parameters, if you want to hear vocal parameters, I mean, if you want to feel vocal parameters. But fortunately, it's not that common nowadays. I mean, I see a lot of time, even lecturers don't teach so much of vocal parameters on students. They just concentrate on vocal resonance. Okay, so and how to teach whether they can elicit or not. Well, you can use some mannequin. You can use a part trainer, or nowadays they have this VR that have haptic response, or VR with a haptic glove. So when you wear the glove will feel you that haptic response, that you can feel, is something warm, or oh, is something hard, or something is firm, and so on and so forth. All right. So that's one thing on examination skills. In terms of teaching them of procedural skills, again, we can teach them through video-based simulations, either using an SIV. SIV stands for self-instructional video, meaning that you see the video and the video can teach you step by step of what to do. And you can enhance it with the SEV, what you call a skill enhancing video. So video that if you see that video, it should enhance your skills of picking up certain thing, of doing or certain things. All right. And this thing you can practice with, again, with a part task trainer, or you can use something like electronic patience that you can do with that. But in terms of eliciting a certain certain procedural skills, then again, a VR or a part test trainer that have that function will help. But not many have that. Okay. So, so how do I teach psychomotor skills to students? Basically, I have this this 5 steps. Sorry, wrong. I mean, the number is going wrong. Okay, this is a 5 steps. The first step is basically starting with analyze. I have to analyze what is the learning objective, and I have to consider whether to break down to what I need to teach. Okay, I will tell you later about this thing. The second step, what I do is basically I will flip the classroom, and usually I will give them an SIV, a self instructional video before if I want to flip the class. Next actually goes to the asynchronous session of discussion. So the ASD sessions, and then after that followed by the SSI session, and later after that we can also have the post-synchronous discussion session. This can be either yes or no. So generally you have about 5 or some most of the time people only need to 4 steps only. Okay, so what is that? So when we come to the first step of analysis on learning objective, I think this is the first thing that we need to do. So when we are asked to teach a student a certain skills, we need to we have to look into what is the learning objective. All right, and I changed the perspective from what I need to teach to what I need the student to learn, because sometimes we teach a lot, but actually what the student learns is actually very little. So we have to focus on what actually you want the student to learn on this kind of procedures that you're showing. Okay. Second, what are the skills need to perform in order to perform the psychomotor skills? What are the skills that they need in order to perform the psychomotor skills? All right. Is it touching? Is it hearing? Or is it just palpating? Okay, this kind of thing. Then during the analysis, I have to look into whether I can do it in one go, meaning that the flow and the elicitation can go in one go, or I have to break it down in sessions. Next is actually how can the skill be best demonstrated to the student? Video, VR, or whatever. Okay. But for this one, I'm using the videos. Okay. Not so much high tech. Now, what aspect of skills need to be highlighted? I think that's the thing, because sometimes when we do certain things, there's a lot of things, a lot of hands movement, a lot of things that we need to do. But usually they come to the small thing that we what really need to highlight so that the student don't forget that important thing. So highlight the important thing is important. And when you use video recordings, I think the important thing is to understand the angle or from where you do, and also the shots. When I say the shots, it's basically not only the angle, but basically how you want to take it. How long is the duration of that shot? Do you want to still photo or continuous? So all of that have to take into consideration. Okay. All right. Now, after I've done all the analysis part, so basically I understand or I know what actually I want to show on the video, then basically I need to prepare the video, right? So basically I will prepare the video in terms of the SIV, the self-instructional video, or in simple thing, SIV is the video that shows you the right or the correct thing. So, okay, so prepare the video that shows the correct thing step by step. So every angle, every shot have to be nice. And usually I just use my handphone to do that. I don't have such big cameras and everything. Just nowadays handphones is actually very easy for you to use it. And then also, if there are special things I want students to pick up, or certain things that students usually miss or people usually miss, that is when I started to prepare my SEV, or the skills enhancing video. It is actually the same video of the skills that you show, like the SIV, but I will basically purposely make certain mistakes on certain steps. Hopefully students who are the good students are able to pick up those steps, all right? Because if you do that, they're able to remember. This is what Professor Etiel Rohr always mentioned, that if you want to highlight things so people can remember, make it big, all right? And then after that, after preparing the video, I will just share the video. The SIV with the students. Usually I use the Google Drive, free, easy. So just put it on the Google Drive and then give the link to the student, and the student can come and watch it, basically. The other thing, actually, student who ask you permission, you know that who are actually watching it and who is not. Okay, I will not give the SEV video, just the SIV video. Then there's an instruction, ask them to practice repeatedly according and basically record their best performance. Where do they practice this thing? Now, what I did with this previous group, actually, they still can go to the simulation lab that we built, the basic simulation lab, the BSL at the level 4 of the preclinical building. So they go there, all right, and basically practice on their own. So they keep on practicing, watch the video, they practice it again and again until they're able to do it well. They think, all right, they think they can do it well. So if they think they have do it well, I want them to record their performance. So they record their performance, and then after that, they have to send the video to the supervisors. Okay. So usually I will create this a Telegram group or WhatsApp group. I prefer Telegram group because it doesn't eat your apa tu, you punya data. So use a Telegram group, so let the student sends to you the video, the best performance video. I don't care whether they edit or they don't edit, they want to cheat. It's up to them. To me, that's not important. The important thing is actually they learn. All right. So don't worry if the student cheat, they edit so that they can have the best one. Fine. In the end of the day, they still have need to perform those things live in front of you. So once they have done it, they send to me, and I'll basically review the video. It's actually, the video clip is very short, usually like few seconds, only like 20 seconds, 50 seconds, or maximum is like 1.5 minutes. So to see how they do it. And then after that, I give a comment back. And this is basically done through the asynchronous session discussion. So it's asynchronous, meaning that they can go to the skill lab in the morning, they can practice with it, or they can go at any time they want, because we follow the open skill lab concept, where the student can go at any time. They just have to make an appointment with the one who's basically the caretaker of the skill lab or the simulation lab for them to go and practice. So when they keep on practicing and practicing, okay, so, and then after that, they record it and send to you. And basically what I did is actually I just review the thing, and I can see what actually they're doing, whether they're doing right or not. And I will basically give feedback to all the videos that it sends to me. It's very short. So I can do it while I'm basically somewhere else in my room, or you can be on the floor, or you can be in with like anesthetist, you can be in the OT, or anywhere you are. Or you can go at home with everything, so you can see it anytime. So no pressure, just look at some videos, and I'm sure everybody like to see videos, right? Even though if the student doesn't send to you, also people send to you a video in your WhatsApp group, so you see the video, and then after that you comment. All right. If good, you praise them and say, okay, this is good, well done, I want you to repeat this performance exactly when we meet, all right, or when we do it again. If not, then basically we tell the student to go back to this sim lab and keep on practicing, recording your performance and send back to us. So this is how the supervisor should correct and give input to those things. And then come to the day. So this one actually, for a synchronous session, is a session that we fix the time. Just now, asynchronous is actually the time is not fixed. They can do it any time. So when it comes to the synchronous sessions, they will basically have it with you, and basically you will ask them to perform or to show the thing. But before they do that, this is where normally I show them the SEV video, the skills enhancing video. All right. Why enhance? Because I think you have to really enhance your skill in order to pick up anything is wrong or not with this video. So you show them, and then after that, let them comment on the video. What is the mistake? So usually for one skills, I prepare about 4 to 5, or sometimes 6 SEV videos, so that they will see, and they will basically see what are the mistakes, and they should pick up. Because some students, if they don't know that skill very well, even the right thing they will say is wrong. So these are the things. And how to prepare these things, actually, there's a tip to this thing. Every skills that you do, list the steps. Let's say one skill, they have about maybe like 15 steps. So you list down all the 15 steps. And if you want to create the SEV video, you purposely pick which step you want to do is wrong. So don't do it spontaneously, plan it out. So let's say, okay, I want to do mistake at steps 5, step 7, step 8, and step 12. So you do mistake on that step, so that you know when during that procedures, the student should be able to pick up that 4 steps that you have been done wrong. All right. So and you do it again, and you discuss it, you debrief the student until they are good. Then after that, I say, okay, fine. Once they have done it, then we can basically still do a live video call. They are in the simulation lab, they can perform in front of you. One of their friends or this thing can basically have the phone basically showing the skills that they want to show you. and you can see how they do it. If they cheated in preparing for the asynchronous session, they will not be able to perform. All right. So these are the things that I do with my student. If they're able to do it well, I mean, during the asynchronous sessions, they should be able to do it well during the live session. Okay. And after this being done, we normally followed by a debriefing sessions. I use the debrief technique for debriefing. The debrief, which stands for diffuse and delineate, bring back, review, in-depth discussion, explanation of key concept, and future use. I'm not going to discuss about this debrief technique. We can maybe discuss some other time about this. So this is what I did with my student. Does the session end there? No. Majority is end there, but I still open you remember the Telegram group? Yes. Or the WhatsApp group. This is where we can ask students to clear any doubt during the training or whatever. They can ask back questions of those things, all right? Or sometimes the thing that they did, you can put on the video, and then basically you can show back them the video, and they can have a discussion of this thing, all right? Okay, so that's basically the 5 steps actually of how I did this flip classroom of psychomotor skill teaching. For exam, we can also still use almost the same approach like what we did in the post synchronous discussion. Okay, if I can show you, let's see if I can. This is not normally how is this thing, right? So the student will send in their videos, how they perform things, and basically I will have to comment on their videos. All right. Let's just end here. All right. If I can share with you this. Let's see. How to share it? Share. All right. Share. All right. So normally this is how the SIV video is. Hi everyone, welcome to the next edition of the Elite video. We're going to learn on the Oropharyngeal Airway. This is a Goodell's Oropharyngeal Airway. It is a rigid tube and having a J-like structure. When properly inserted, the Goodell's Oropharyngeal Airway will follow the curvature of the tongue and keep it from falling backward, blocking the upper airway. It has 2 openings. The distal opening is called the outlet, while the proximal opening is the inlet. Bite block at the inlet help to prevent the teeth from coming together and close the airway. For sizing, we measure from the angle of the mouth to the tip of the lower ear pinna. We insert the oropharyngeal airway with its inlet facing the hard palate. Once reach the end of the hard palate, turn the oropharyngeal airway 180 degrees and slide it in fully to the hypopharynx. Make sure while doing this it does not push the tongue backwards.
We are seeing the WhatsApp group.
Pardon? Sorry.
We are seeing the WhatsApp group.
WhatsApp group. Okay. Oh, sorry.
Make sure
all right. I'm caught. because I wanted to show how the students' performance. I was looking for that. Okay.
So there was a SIV.
Yeah. So this is the SIV. So I can stop this thing now. All right. You stop it. Okay. Now the student will watch this video, and then after that they will go to this video. Okay. And the student will basically show their performance. Oh, sorry, not. Can you see this?
Not yet.
This one.
You're sharing screen?
Okay. 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 All right. Share screen. Okay. It is not the same video, but just to demonstrate actually what's happening. So
there is no spinal cord here.
Can you see this?
Yes.
Okay. So these are some of the things the student will perform. They will show and this is based on the SIV video. So this is their performance and based on the video, I will comment on what they do.
The narrator, who is the narrator?
The student themselves.
Okay.
Everything is done by the student. This is a student video. Okay. So this is where I told you that they can do editing in order to show nicely, but when it comes to the real live sessions, they would, example like this one, you can see that how they apply the C collar is too big, it is loose, it doesn't work.
And then we put the strip onto the forehead and the other one onto the chin, but make sure it's not covering the mouth.
Okay.
So did they send it to you through your certain platform or directly?
Yeah, they send it through WhatsApp.
WhatsApp. Oh, so you don't have your WhatsApp number. Okay.
Yeah. So basically, we create a group when we want to start this thing. Basically, we create the WhatsApp group, and after that, we communicate through the WhatsApp group.
Okay.
So example, when they did this, they did it in the day. I was busy in the day, so I have no time to review. So when at night, around 9, before I go to bed, I just see the video. I say, okay, ni salah ni, ini betul ni, very good. So that's the thing. So students say, Then I say, okay, fine. This one, go back to the skill tomorrow anytime when you're free, and basically try to do it again and try to read better based on whatever I comment. So that's how we do. So there's a lot of some ding dong. Some of them, the second try, they do it nicely, very well, before they come to the SSI, which is the synchronous session. So the students are doing a lot of things that basically is really on their own because I do believe of active learning. So this is one of the way how to do this thing, rather than we demonstrate, we just show the video and this thing. And I think this is easy because when you have several groups the next time, I don't have to create the video. It's only once, all right? And basically the only thing that I have to be with them is actually only 2 sessions, the ASD session, the asynchronous session, and the SSI session, the synchronous session. There's only 2 sessions. And the SSI is actually spread, so they can send it the thing at any time before the SSI session. And during the SSI session, that 2 hours or that 3 hours, depends on what are we learning. Then basically we have the video call, and all is free. Okay. Sometimes some groups, example for disaster, I use the Padlets where the student basically we have a discussion over there. We can also use Padlet for that. But that one is normally not for skills, but that one's for disaster teaching. So I use Padlet. So skills I use a simple WhatsApp group for this kind of thing. Yeah.
So if the student doing very well in their SIV, they're sending the clips back to you, they're doing very well. Do they repeat the assessment again during synchronous session?
Correct. They have to. Because like I said, because students are very clever. They are so imaginative. They can edit the whole thing and say, wow, like a Hollywood movie, this thing. So now let's see when you do it face to face. So that's the thing. So basically, instead of teaching them, I only have to be that shorter period of time just to make sure whether they are doing it correctly or not. So it is much, and the good thing is actually previously when we do a face-to-face teaching, we have a bigger group. Sometimes some of them do, sometimes some of them don't do. They just observe and they give you the logbook sign, observe. But this one, we make sure all of them have to perform. So it's very short, only maybe 2 minutes, or even normally it's less than a minute for them to perform that skill. So I can verify all the 6 or 10 or whatever number that, yes, they have done it in front of me. I verify this is correct.
Right.
Yeah.
So they have the arranged synchronous session with you, within a small group or individually?
Again, the group?
Do you have to arrange specifically? Because you're making sure everybody has a synchronous session that is fair. Everybody has a chance. So you arrange it individually, or with some small groups.
So there is, because for us normally we divide the group, the student into smaller group, a group
Smaller
of like
groups.
6 or
Okay.
5 or 7, and that group will basically have with us.
Yep.
All right, and well, other supervisors can also do the same way if they want to or whatsoever lah.
Yeah. Right. I suppose. Can we call for question? Anybody wants to? Yeah. Sure. Anybody wants to tap on experience and ask something that you
maybe actually I just have one more slide if I.
Sorry.
Okay. I just have this one more.
Didn't
slide.
realize. Okay. Please sum up. Okay. Thank you.
Just a quick one. Okay. For those of you who are not sure about this, is it? Alamak, salah. Sorry. Okay. Are you seeing the slide?
Yes.
Okay. All right. Okay. This is actually the open sim lab concept that we use here in our preclinical building that we have basically created last time. Usually when you have a sim lab or a skill lab, usually students will enter that lab only when there's a lecturer, right? But this open lab, they can enter it anytime. Okay, the only thing is that they need to schedule the appointment. And how they schedule the appointment, they can schedule the appointment online. So we have people who are there basically taking the appointment. Just like when you're going to your TGV or GSC, when you buy tickets online, it's just like that. So you can fix your own time, which room you want to go for, what skills you want to learn. All right. And when they come, they have to follow a very strict SOP of using the lab. The lab, basically they have to sanitize their hands and things before and after. They have to wear masks, make sure all the time. Okay. And basically they will be symptomatically screened lah. And we basically limit the number when they appoint, so we can basically limit the number of how many people can go in the room at any one time. So these are the checklists to conduct a face-to-face training that we have basically created, and our BSL are using this thing. So I think so basically students can have time, and we don't know, different group will have a different free time. So when they have free time, they can go there. So study is really flexible. It's ubiquitous. It's anytime, not anywhere. They have to do it in the skill labs, but it's anytime. Okay. So now I'm done. Sorry. Okay.
Thank you. So we're probably going to spend another 5-10 minutes. We drag it a little bit longer, but that's okay. Feel free if you have other commitments. Don't worry. This is a free sharing session. So yes, please ask the question, or you can type in the chat. Performance for
how do you track the performance for SD? Actually, it's quite easy because the group is small, because we have divided our group. Usually not more than 10. So basically we track them whether they have done those things, and you can see that you can make your own notes that student A have done and they have done it well, or you can just open your Telegram and just look at those things. And usually how I track, that's how. So I make sure that all of them has performed it. And during the SSI, what I did is once they have performed, I can just make a note that this fellow have done it well. Give some marks over there. So that's how I keep track of during both the ASD and the SSI session.
Right. You can turn on your mic to ask questions. That's also fine. While you're thinking, I have one more question. Actually, I want to know, is there a reason to give the skill enhancing video after they send in their assessment video? I mean, it is actually sent to them. The skill enhancing video was sent to them before their synchronous teaching. Am I correct? No. I got a sequence wrong.
So basically, I sent to them at the beginning of the posting, sent to them all the videos that they need to see, including
SEV.
No, all the SIV videos.
Yes, SEV. I'm talking. Yeah.
No, the SIV.
Yeah.
The right one. So because I don't send them the wrong videos, because it will basically, some of them somehow or other they might get confused and think that the wrong thing is the right thing. So I never give the SEV to the students. So it's only the SIV videos that I give to the students. For the SEV video, it's only during the SSI session, the synchronous session, I show them the SEV video, and basically they comment on those things.
Okay.
Right. They can comment in basically in group, and basically I invite their comment. Maybe student A can say like this. It doesn't mean that he or she is right, and I can still ask the student B, what do you think of what student A is saying? Is it correct? And usually I do a little bit of debriefing here. I give them probing questions saying that, why do you think it's correct? What if it's done this way? Do you think it is still correct? Why do you say it's correct? What is the important thing that you want to achieve by doing this thing? So a little bit of debriefing. So to stimulate their thinking, to stimulate their critical reasoning of doing certain procedures. So that by doing this, they will basically know that, oh, if I cannot perform this way, I can perform some other way, but I still achieve that endpoint. So this is actually what we want our students. So that they are not robotic, they only follow the SIV way. Kalau stuck, tak boleh buat lagi dah. Nope. So during the debriefing, we'll teach them on, okay, what is actually the main aim? Okay, so examples like putting the oropharyngeal airway or intubation. The main aim is actually keep the airway patent. So if you can't intubate, what do? You can remove those things and basically maintain a patent airway by just putting an OPA and basically back the patient. So these are the things that they have to think. This is the importance of the SEV. So knowing what's next, knowing what's wrong and what's the next thing if I cannot achieve this way.
Thank you. Yeah. There's a question from Dr. Nasri. Any room for peer assessment?
Any room for peer assessment? Prof Tong, to make it more official and easy.
No, the one before. Dr. Nasri asked, any room for peer assessment? I mean, this is the video was sent to supervisor for evaluation.
All right.
Yeah.
Well, at this point in time, basically, every supervisor is with their own student. We don't give to the other supervisors because the whole thing is basically for own. But you can send it to other supervisors if you want to. There's no harm in it, right? Because the skill that we teach is a skills that is basically common to to doctors. And as medical and as doctors, any doctors, they should know how the skills is being done. If, let's say, the supervisors forgot on how a skill is being done, they can quickly review the SIV video themselves, because we put it all on the UKM folio. See the UKM, and then they can say, okay, I know, I remember now how to do it. So yes, peer review assessment also can be done. That's not an issue.
Right. Yeah. Just to respond quickly to Dr. Nasri, UKM folio, if you put it all the video as resources in UKM folio, it will be archived every session. So I have to reactivate it every year, every semester. So in Microsoft Teams, it basically belongs to all of us and is always there. So anybody can access it.
Correct. This is actually the advantage of UKM folio, right? Because compared last time, in iFolio, whatever you upload, nanti next group dia hilang. You have to upload balik. Tetapi UKM folio tak, sekali upload, kerja settle. Basically quite good lah in terms of that thing. Is actually quite user friendly. But the student video I will not upload on this thing because nanti it got too many. Nanti they eat up the space. So basically the student video sent to us. And that's why initially last time I used WhatsApp group. Now I use Telegram because WhatsApp group dia akan ambil you punya data pula. Habislah data you. So tak best, tukar pada Telegram group. So Telegram okay, dia tak kacau you punya data. Okay lah.
Yeah. So I'm sending a link for those saying the Microsoft Team. All this material will be uploaded in Microsoft Team. So there also some interactive session we can do on Microsoft Team. So anything you want to ask resources or you want to ask experts around, they are all in the Microsoft Team active learning group, and hopefully we will respond. I mean, as because we get email notification, right? So any other question, because we actually overshot some time. I think
Prof Zaliha has opened her video. I think she wants to ask
some question to ask. Okay,
but not to me, to Akmal, right?
Yes, Prof Zaliha. Yeah.
Assalamualaikum and good afternoon to all. Thank you, Prof Ismail. I think it's a very wonderful way of teaching skills, and certainly I think in ONG we have a lot of room for utilizing this to our advantage, not only in undergraduate, but I think more so among the postgraduates. I just need to get the sequence right, if I may confirm with you. You start off with the SIV, at which point you already have a checklist of the things, the steps that are essential. And then from there, you move on to the SEV. Is it after the SEV that the students then perform on their own and send you the videos?
Okay. Like I see, we have that 5 steps. The first is actually the analysis, which is very important. How you want to teach that skills, okay? Whether you can teach one whole shot or if you break it up. Okay, that's the first thing. So after you've done your analysis, then only you prepare the video. How to prepare the video, which I didn't show just now, sorry. Basically, you list down the steps of a certain skills. And this is actually best is done in groups, okay? Well, I can say the best is actually do a Delphi technique, but you can just list the steps in groups, okay? And then after that, so that all the lecturers in the thing agree that, okay, this is the way how we should do it, or this is the way how the UKM way of doing it, all right? Because I mean, students can also see videos from other links so that they might get confused, because that is actually one of the student feedback to me. They said, we have so many videos on this, so we don't know which one is one. So they said, you can produce one? Actually, that was told to me about 3 years ago, and that's basically started this thing. I said, oh yeah, why don't you can do this thing and you can archive it? And people say, this is actually QA. Okay, fine. So basically, you get the steps of the correctly how to do it. Okay. If there is any variation, you have to discuss among the group in the sense that, okay, so we agree to this is the way, the correct way. Once you have done that, basically, then you produce your video. You shots and produce the video. Okay. From even kalau boleh discuss about the angles that you want to show. Example macam putting collar. One thing actually putting cervical collar is best to learn through video rather than directly. You know why? Because we can get the camera to a certain angle that mata pun tak tengok, tak nampak. So a certain thing which is actually very important. So your shots and everything, so you siap the video. Okay, the music and everything later lah. Itu kalau nak cantik-cantikkan lagi. Tapi the best thing actually jangan lupa ada this what we call as this closed captioning. You know the what you call the subtitle tu, tulis so that kalau student sometimes dia boleh baca so nampak lebih jelas lah. So once you have ready that video, you can send to your colleagues everything to see and everything. Kalau nak tukar tak nak, okay, then you kata okay siap, there's one SIV video. After you have done that, then only I'll prepare my SEV video. The SEV actually from the same list of, let's say katalah ada 15 step of the procedure, we will basically randomly choose which step. Maybe first video, step 1 and 6 is wrong. Second video, step 3 and 7 is wrong. Third video, step 2, 5 and 8. So we mix and match. So then maknanya student takkan tahu, ada dua mistake aja. No, you can have one mistake, we can have 2 mistakes, we can have 3 mistakes, or we can have 4 mistakes or 5, whatever, up to you. Okay. All right. Then, so once you have done that, you can basically do you can shot the thing again. Shooting is actually very easy. Pakai handphone saja. So that will basically create video 1, video 2, video 3, video 4, video 5, video 6, or whatever lah. So you have a set of, okay, let's say endotracheal intubation, ada 1 SIV video and you have 7 SEV video. All right. And the mistake is actually memang banyak-banyak lah. And then you show it to your colleagues lah first. So can your colleagues able to identify that or not? So the mistake tu must be quite obvious lah kan. Sebab as macam colleague pun, okay ni memang salah ni. So macam everybody agree. Sebab kalau you buat apa yang benda-benda yang macam like borderline, maybe somebody kata, actually there's another way also. Actually that one also can be done. So we try to not to put that things that people can argue. So clearly cut, actually that is wrong. Okay. Then you have these 2 video, 1 SIV, 7 SEV. Then when you give to the student, give the SIV only. Jangan bagi the SEV. The SEV you keep with you. Sampai come the face-to-face session, then you show them. Mula-mula you can start as review back all this thing because they have done it. They have sent you the video. Of course, they should have done well. Then you say, okay, now I want to show you some of this video. See whether you can pick up some of the mistakes. So tunjuklah. There are students who basically pick up the right thing. So you know that the student doesn't know that well. I mean, doesn't know that this thing. Some students able to pick up the wrong thing. Some students will not be able to pick up. Let's say kalau you ada 4 mistakes, they will pick up 1 or 2. So you know that they are still not good. So this is what I call is enhancing your skills. The skills to observe. It's like macam consultant. When the consultant don't palpate the abdomen, but when they see the student palpating the abdomen, you can say, the way how we palpate tu salah, kan? So actually, it is the case. We're trying to get the consultant level to the medical student level, so they're able to achieve that or not. That's the way lah. So that's it to answer your short question.
The SEV is at the end of the flowchart lah. If you draw a flowchart on how you teach the.
No, the end point is when they perform live.
That's what I thought. Yeah. SIV, SEV, then they perform live.
Correct.
Where does their own video come in?
When you have shown them the SIV much earlier, they will record that thing and send to you. But that is asynchronous before the SSI session, before the synchronous session.
I see. Okay. So their own video comes right after the SIV.
Yes. After you give them the SIV, ask them to practice. So whenever they're ready, they send their video to you. So, but that is all asynchronous.
I see. Then you have the face-to-face and the SEV.
Correct.
Right.
Yeah.
Okay.
So SEV acted also some form of formative kind of assessment.
Yeah, you can use SEV actually as a part of formative assessment. If the student cannot, I mean, in during the pandemic, student cannot this thing, so the other way how to teach the student, to test the student whether they know or not, you can use the SEV.
Yeah.
And I think that's what we do. Some of the SEV we use for assessment, so whether the student really know or not.
Yeah. I was thinking the same idea. We were in not procedural but management plan. We we also list out wrong management plan and see whether they can pick up the wrong management plan. So the concept is very interesting. You just put in some areas for them to pick up. They are become more sharper in skill. It's fantastic. So I think we are aware of time. I'm just going to conclude. A lot of things we can discuss, and this is really interesting. And thank you, Prof. Akmal, and also Prof. Ismail sharing the session with us. The wonderful thing is all of us agree that at the end of the teaching session, it has to come back to some form of assessment. That close the loop of learning, because what we are interested in is actually student learning, not us giving information, right? So that's the most important part of active learning. And thank you very much. And I do hope that you could join us again next session, which is a month time. So in a month time, we have How I Do It session 4 series 4. Okay. And next week, we're going to have an e-clinic session again. E-clinic, I'll set up the poster again. E-clinic session is not sharing, is in a way, 1 hour session. So but a lot longer. So you can see how experienced teachers and share their thoughts. As How I Do It session, those are interested here, please, you can always send email to me and we can always slot you in. No matter how small or how big, there's no small or big, as long as your experience and the teaching session, we would like to hear from you. And it's a peer support thing. So don't think this is a platform for the expert, but a platform for peers. Okay. So with that, I thank you very much. And this is a great participating many people, and hopefully become a culture for future. Thank you very much, and enjoy your weekend. Not weekend,
thank you,
evening.
Everybody. Thank you, Prof. Tong.
Thank
Okay.
you, Prof.
Bye.
Bye.
Thank you, Prof.
Thank you.
Thank you, everyone.
Thank you, Prof. Zah, and everybody. Thank you very much. Bye.
Thank you to the speakers. Bye.
All
Thank you,
right.
Mawada.
We have a QR code.
Oh, ada QR code.
Yeah,
okay.
sorry. I didn't announce that.
Ada markah kan? Sekejap. Okay, wait.
Kita akan masukkan.
Wait
Ispel, Prof.
Ya?
Yeah. Masuk ispel ke?
Ispel, ya.
Log masuk berjaya. Oh, okay. Alright. Masuk kat. Alright. Okay. Okay, Prof. Tong. Thank you. Okay, bye.
Thank you. Bye. Assalamualaikum.
Waalaikumsalam.
Kemana? Supaya dia tak